Hi guys! My name is Mae Garciano, a BSN-III student from Negros Oriental State University. So, I will continue the discussion about schizophrenia and other psychoses. You have already seen the first part of the video which was discussed by my partner, Miss Mary Elizabeth Solivio. In this video, you will know the test and diagnosis of schizophrenia, its prevention, medical management, and its nursing management. So, let's start! No medical test can confirm schizophrenia, but a CT scan and MRI are often used to rule out other brain disorders. Now, psychiatrists and psychologists typically make the final diagnosis of schizophrenia based on information given by the patient, family, and friends. This includes the time symptoms have been present for more than 6 months, changes in a person's level of function, developmental background, medical history, family history of the illness, and responses to medication. There is no sure way to prevent schizophrenia. However, you can do the following to make you less likely to develop the disorder, especially when it runs in your family. So don't use drugs, avoid abusive or traumatic situations, keep strong social ties, learn how to manage stress, take care of your body, take steps to stay well if you're pregnant or trying to be pregnant, and see a psychiatrist. Here's how schizophrenia is medically managed. 1. Drug therapy. Schizophrenia is mainly treated by antipsychotics or neuroleptic drugs, and psychotic symptoms must be present 12 to 24 months before patients receive their first medical treatment. Number 2 is electroconvulsive therapy. These are rarely used, but it is for patients with acute schizophrenia and those who can tolerate or don't respond to medication. And it is effective in reducing depressive and catatonic symptoms of schizophrenia. And number 3, other treatments. These include compliance promotion programs, social treatment and rehabilitation, vocational counseling, supportive psychotherapy, and appropriate use of community resources. Antipsychotic medications, also known as neuroleptics, are prescribed primarily for the efficacy in decreasing psychotic symptoms. They do not cure schizophrenia, however, they are used to manage the symptoms of the disease. These first-generation antipsychotics or conventional antipsychotics have frequent and potentially significant neurological side effects, including the possibility of developing a movement disorder that may or may not be reversible. Second-generation or atypical antipsychotics preferred because they pose a lower risk for side effects than do first-generation antipsychotics. Some antipsychotics may be given as an intramuscular or subcutaneous injection. The vehicle for depot injections is sesame oil. Therefore, the medication absorbs slowly over time into the client's system. So, there are common medications available as in this injection include fluphenazine or prolixin in decanoate and enanthate preparations and haloperidol or haldol in decanoate preparation. Extrapyramidal side effects are reversible movement disorders induced by neuroleptic medication. This includes dystonic reactions. It appears early in the course of treatment. Pseudoparkinsonism or neuroleptic-induced Parkinsonism includes a shuffling gait, mask-like faces, muscle stiffness, or cogwheeling rigidity, drooling, and akinesia. And akathisia is characterized by restless movement, pacing inability to remain still, and the client's report of inner restlessness. Tardive dyskinesia, or a late appearing side effect of antipsychotic medication, is characterized by abnormal involuntary movements such as lip smacking, tongue protrusion, chewing, blinking, grimacing, and coriform movements of the limbs and feet. We have seizures. It is a sudden uncontrolled electrical disturbance in the brain, and it is an infrequent side effect associated with antipsychotic medications. Neuroleptic malignant syndrome or NMS. This is a serious and frequently fatal condition seen in those being treated with antipsychotic medications. Then last one is agranulocytosis or failure of the bone marrow to produce adequate white blood cells. Non-neurologic side effects include weight gain, sedation, photosensitivity, anticholinergic symptoms such as dry mouth, blurred vision, constipation, urinary retention, and orthostatic hypotension. Other psychosis recedes in addition to continuing on medication. Psychological and social or psychosocial interventions are important, and this may include 1. Individual therapy. Psychotherapy helps to normalize true patterns, and also learning to cope with stress and identify early warning signs of relapse, and can help people with schizophrenia manage their lives. Number 2 is social skills training. This focuses on improving communication and social interactions and improving the ability to participate in daily activities. Number 3, family therapy. This provides support and education to families dealing with schizophrenia. And lastly, number 4, vocational rehabilitation and supported employment. This focuses on helping people with schizophrenia prepare for find and keep jobs. Nursing assessment, we have recognized schizophrenia. Note the characteristics, signs, and symptoms of schizophrenia. Establish trust and rapport. Don't tease or joke with patients and expect that the patient is going to put through rigorous testing periods. Introduce yourself and explain your purpose. Maximize level of functioning. Assess patient's ability to carry out activities of daily living or ADLs. Assess positive symptoms. Assess for command hallucinations like explore answers. Assess negative symptoms. Assess for the negative symptoms of schizophrenia. Assess medical history. Assess if the client is on medications, what these are, and adherence to therapy. And lastly, assess support system. Determine whether the family is well informed about the These are the examples of nursing diagnosis with patients with schizophrenia and other psychoses. Here are the 6 schizophrenia nursing care plans. Now, for nursing interventions, we have established trust and rapport. Don't touch the client without telling him first what you are going to do. And maximize level of functioning. Avoid promoting dependence by doing only what the patient can't do for himself. Promote social skills. Provide support in assisting him to learn social skills. And ensure safety. Maintain a safe environment with minimal stimulation. Ensure adequate nutrition. Monitor patient's nutritional status. Keep it real. Engage patient in reality-oriented activities that involve human contact. Deal with hallucination by presenting reality. Explore the content of hallucination. Promote compliance and monitor drug therapy. Administer prescribed drugs and encourage the patient to comply. And lastly, encourage family involvement. Involve family in patient treatment and teach members to recognize impending relapse. So that's it, guys. I hope you have learned something in our video. This is actually in compliance of our NCM 105 subject. So hope you enjoy and